I'm Phil Molyneaux. I'm a professor of interstitial lung disease at Imperial College and director of the clinical research facility at the Royal Brompton Hospital. I'm talking to you today as the chief investigator of the CORAL study. This was a phase 2b parallel group study of nalbuphine ER versus placebo for chronic cough in patients with IPF. It was a randomized, double-blind, placebo-controlled study that enrolled 165 subjects with IPF and a history of chronic cough. Participants were randomly assigned to receive either nalbuphine at one of three doses, 27 milligrams, 54 milligrams, or 108 milligrams BID, or placebo. The primary endpoint was relative change from baseline in 24-hour cough frequency at 6 weeks as measured using an objective digital cough monitor. There was a significant difference in the relative change from baseline observed across all dose groups compared to placebo, and a reduction in cough was seen by week 2, the first measured time point. The most common adverse event with all nalbuphine groups were nausea, vomiting, constipation, and dizziness. However, discontinuation due to AEs was similar between the combined nalbuphine groups and the placebo. Not only did we see a significant drop in the objective cough counts, we saw patients reporting an improvement in their cough across a number of PROs. These improvements started rapidly after taking treatment, with the first time point of 2 weeks showing a significant change. Cough's a significant problem in patients with IPF, and it affects between 50 and 80% of patients depending on what metric you use. But what we've shown here is that nalbuphine is able to reduce cough, not only objectively when we measure it with a cough counter, but also when we use metrics that patients self-report.